Okay, why don't we get started? My name is Tricia Crowley, and I'm president of the League of Women Voters, and I welcome you all to the beginning of our programming for this upcoming year. And we're happy to be hosting this event, but I'd like to talk about a couple of things that are upcoming before we get into the meat of this. So the county governance study, which we have been working on for a year and a half now, is going to be coming to a conclusion. There's two meetings, one an informational meeting on September the 7th at 6:30, and one will be a discussion and voting meeting on September the 12th, Monday at 6:30. Both of those are Zoom. You'll be receiving information and invitations in the next week or so. We have In the Know, a league update meeting. It's a very short meeting, just something to drop in and see what's going on. But we will have a person from Moms Demand Action, and that should be interesting. That'll also be Zoom. You'll get an invitation. There's a judicial candidates forum. It's going to be at the law school on September the 14th, at Wednesday, 6 to 7 p.m. Co-sponsoring with the women law students. A workshop on leading a book discussion by Paula Kaufman, and that will be September 17th, Saturday at the library. And two programs on the upcoming election. The 2022 Know the Candidates, which will be September 21st, Wednesday, 6:30 to 7:30, and a program on the integrity of the local election process, which will be September 28th. So all of these things will be in your voter, which will be coming out tomorrow. So you can check it, put them in your calendar at that time. And also, of course, they're on our league website. So with that, I'm going to turn the discussion over to Cecile Steinberg, who is very familiar with Planned Parenthood in Illinois. And Cecile, you can take it away.
And it's my great pleasure to introduce Nikita Richards, who is on the board of Planned Parenthood of Illinois. Nikita is currently serving as the Community Relations Manager for the city of Bloomington. A Navy veteran, Nikita was appointed to the Illinois Council on Women and Girls, where she works alongside Lieutenant Governor Stratton on behalf of women and girls across Illinois to create policy that promotes equity and opportunity. She is on the council, chair of leadership and inclusion, and she's also a member of the Academic and Economic Opportunity Committee. In 2022, Ms. Richards was recognized by the U.S. House of Representatives for her leadership accomplishments. And in addition, she was inducted into the Illinois State University College of Arts and Sciences Hall of Fame. I think it's great that you're willing to talk with us now, Richard and Nikki, and I give it to you. I'd also like to mention on the web as well is Lisa Villani Gale, who's the staff of Planned Parenthood of Illinois. Go for it.
Thank you so very much. You mentioned my trusted colleague Lisa is here joining us as well. So I'm very grateful for her support. And again, just excited about this opportunity. Thank you for having me. An ally to my beautiful daughter, a believer in women's right to choose, and a staunch supporter of women's reproductive health. Opportunities are so incredibly meaningful to me. So again, thank you very much. In addition to serving as chair of Planned Parenthood's Illinois Board of Directors, I also serve as its joint ILPPIA Chair of Diversity, Equity, and Inclusion, where I've proudly the compassionate and robust care for patients no matter what. Planned of Illinois strives to make access to comprehensive, affordable reproductive health care for all individuals, no matter their race, ethnicity, sexual origin, age, income, or zip code. We have 17 health centers and offer the full range of reproductive health services, including abortion care, services, STI testing and treatment, cancer screenings, gender affairs, and so much more. A lot of people aren't aware about these kinds of services that but we're so much more than just abortion care. We are central to communities across this country. In partnership with schools and community-based organizations, we complement the direct services in our healthcare centers with inclusive, medically accurate sex education aimed at promoting healthy relationships, reducing unintended pregnancy and STIs, combating health disparities, and connecting youth with high quality care. PP is the only sexual and reproductive health care provider in Illinois team in Springfield. As such, PPIL is able to utilize direct service expertise to inform public policies that advance patients' care, support access to affordable health care for all. Over the past year, has worked in coalition to improve Black maternal health care outcomes and increase personal health and safety education for K through 12th grade students by the Keeping Youth Safe and Healthy Act. It's inclusive, medically accurate, and age-appropriate sex education for young people in the state. For decades, PPIL has led the way to maintain Illinois as a haven for reproductive rights and healthcare access in the Midwest. And we continue to do so for decades to come, especially with all of you behind us supporting. As a 501c3 not-for-profit, there is a limit to what policy and advocacy work we can engage in. Thus, we also have a sister organization, is Planned Parenthood Illinois Action, a 501c4 that can in direct lobbying in grassroots organizations. I know sometimes the difference can be for people to identify. So I want to make sure that I make that clear. As I'm sure most of you are aware, Illinois is considered a safe haven state for health in the Midwest, as we have secured access to abortion care while we are surrounded by states that have severely restricted it and banned it altogether. We're not having it. Upon the fall of Roe, we immediately began seeing surge in patients traveling to our health centers from out of state for abortion. In August 2022, PPIL saw more out of state patients than ever before. Nearly 30% of our abortions traveled in from another state. That is a remarkable number, but it all speaks to the progressive and outstanding work that we're doing here in Illinois. Those from out of state can feel safe to know that they can receive the care that's needed. Before PPIL would see patients from 10 to 15 different states besides each month, with the most out-of-state patients coming from Wisconsin and since Roe has fallen, we've seen abortion patients from more states, with the most out-of-state patients coming from Wisconsin and Ohio, with new bans in place. We are seeing patients come from as far as Florida, Mississippi, Texas, and many states in between. PPIL continues to see the same number of Illinois as we've seen historically, even as we see this dramatic in the number of out-of-state patients. Planned Parenthood of Illinois has been able to current patient surge without decreasing services to in-state patients because we prepared for this outcome for years. This was no surprise. We've taken active steps to meet the anticipated surge of 20 some odd thousand to 30 some additional abortion patients annually. In the past several years, how has opened new health centers near the Wisconsin and Indiana borders. Downtown Chicago Loop Health Center expanded our abortion navigation and expanded our telehealth services, including offering the abortion by mail after a telehealth visit to qualifying patients with an Illinois address. PPIL recently announced a partnership with PPWI abortion care providers from Wisconsin traveled to Illinois several days a week, expanding access to care at our Waukegan Health Center and across the state. Now, not only being prepared, but being in a position where we understand the severity and the importance of providing this kind of care, so that we partnered and now have providers coming into Illinois to make sure that our patients go unserved. Remarkable. I am thrilled to share that we have also the size of our healthcare center in Champaign, a project that has been in the works for several years now. Starting this week, this newly expanded healthcare center will begin offering an abortion service. We're so thrilled to meet this moment, expanding access to care, both in our local community and assuming responsibility for neighbors who have lost access. Previously, our location in Springfield has been experiencing some of the highest numbers of out-of-state patients, making pain expansion even more critical. So I know I've shared quite a bit with you, but nothing hits home for me like a personal story. So if you would allow me the time, I'd like to share that story with you about one of our recent patients that might help what we do best at PPIO. There was a patient scheduled at Planned Parenthood of Wisconsin on June 25th, 2022, one day after the US Supreme Court overturned Roe. Because the ban immediately went into effect, her appointment was canceled in Wisconsin. So she needed care quickly because she had very limited time to work with, as she was a single mother, a single parent, twins, and she needed to coordinate childcare and her travel arrangements to travel to Illinois for abortion care. The partnership between PPIL and PPI meant we could care for her days later in our Waukegan Health, close to the border. Wisconsin provided transportation support with and Illinois provided financial assistance for the procedure, allowing the patient the health care she needed quickly and compassionately. This is huge. I hope that by hearing this one example of just we've been able to meet the needs of our patients in the midst of all of it, gives you a better insight into how we're operating and just how important this work is. And so I know many of you have been involved for years. Some of us are entering the allyship race at different places of our lives. But all of us, I know, are interested in understanding ways in which we could do more, better service. And so I wanted to share at this time some ways in which you could volunteer, some ways to get even that much more involved. You can volunteer to help Planned Parenthood at ppil.org/volunteer. Currently recruiting volunteers in our Champaign location to build our clinic escort program. As you know, clinic escorts are so incredibly important. They provide support to our patients as they enter the healthcare center. They shield them from protest, provide affirmation to our patients. A lot of well-meaning supporters are to host or transport patients as well. Our abortion fund partners in Illinois, Chicago Abortion Fund, and the Midwest Access Coalition have accepted volunteers, made such arrangements for years. So this is not new to them. They're very well versed and assist our volunteers in whichever way they're willing to donate their time. Support those two organizations rather than starting our new or any type of efforts. So please support them as well. You can also donate to Planned Parenthood to those two abortion funds. Again, they are the Chicago Abortion Fund and the Midwest Coalition. And I like to think that this last way to volunteer and participate is probably one of the most bravest, and that is to share your own abortion story. Now, more than ever before, we need people to stand up and share their abortion story to fight the stigma. And so if you are willing to do, I would like you to please visit ppio.org/my story to share your personal experience. There's nothing like word of mouth test to help people feel as though they are part of a tribe, they're not alone, and fight and debunk some of the myths that are out there. So going forward, PPIL you to improve and expand in every way we can by doing what's best. And that's leaning into these types of partnerships, engaging with support of the state and the country, and advancing our service delivery, providing care no matter what. I want to thank you so much for your time. Thank you for this opportunity and answering any questions that you may have. Thank you.
Nikita, I think we'll start with the questions that were turned in ahead of time, but in the chat room, people are saying they're having a hard, that you're choppy, your audio is. I wonder if we could try, I hate to ask you to do this, try having your video turned off. See if that helps.
Let's try. I'm so sorry. Technology still.
That's fine.
Let's see here. And if you would like, if there's any portions of, my discussion that you'd like me to either repeat or go over, more than happy to do so as well.
I do think that's better. So let's just do that now. The first question has to do with funding. What kind of funding will be necessary for Illinois Planned Parenthood to meet the demand for the increased services? And a second question is, will additional funding be coming from the National Planned Parenthood organization?
So I hope that you all can hear me. How does this sound right now?
I think that sounds better. Mm-hmm.
Awesome. And so if I understand, the first question was regarding funding. What kind of funding would be necessary for Illinois Planned Parenthood to meet the needs?
Yes.
The demand. Okay.
Mm-hmm.
Well, PPIL is currently working to raise $40 million for our Resolve campaign, over and above our general operating fund. So the Resolve campaign funds would be used as an expansion planned in order to meet the surge of our patients. And so for anyone who's in those particular funds, you can visit ppil.org. And what was the follow-up question?
And the follow-up question is, will additional funding be coming from the National Planned Parenthood organization?
Well, PPIL is a part of a collaborative fundraising partnership, PPFA, the national office. All unrestricted gifts at either organization from Illinois donors are shared between both organizations. And this program helps us unify our message, limit cost, and honor donor intent. In addition, we are eligible for from PPFA as well, which will apply for, which we apply for on a national.
Okay. And this next question that was submitted ahead of time is, do you think Planned Parenthood will be able to find necessary real estate and staffing for the increased demand?
That's a good one. So at this time, our real estate needs are addressed. Staffing has been a challenge for all of our healthcare providers during the pandemic. PPIL has developed close relationships with our sister affiliates and neighboring states, which has resulted in some staff sharing since the fall of Roe. And an example of that, of how, Wisconsin comes down to Illinois as well. So kind of helps, paints this picture of how we're meeting those needs. And we are doing our absolute best to be the best employer we can be, improved our pay scales for health center staff to remain competitive.
Okay, thank you. A third question is, are Illinois Planned Parenthood providers concerned about being sued by other states for providing care?
This is a question that we hear, or a concern that we hear often. And so this is a situation where our legal team, abortion is legal in Illinois, and so we're safe there. However, there were some initial actions soon after the Texas law went into effect. We haven't seen any additional lawsuits since then.
Okay. Someone is saying, I've been giving to the National Planned Parenthood organization for years. Does any of that money trickle down to the Illinois Planned Parenthood organization?
Yes, yes. I want to say thank you to whomever sent in this comment and question. We certainly appreciate your donations. And the second thing I want to say is, yes, as a part of the collaborative, we certainly, that money does trickle down to the Illinois organization. Thank you.
I think you answered, I will read the question, but I think you addressed part of it in your presentation. The question is, currently, the only abortion choice the Champaign Planned Parenthood facility offers is the abortion pill. Are there plans to expand the types of abortion services that are offered? And I think you said in your opening that there are plans to expand it.
Yes, yes, we are expanding our services at Champaign to add in a clinic abortion. So that is the change there. At the moment, PPI is the only provider of in-clinic abortion in Central Illinois. And so many of our patients opt to receive medication abortion via telehealth, which is offered by several providers, including PPIO.
I'll jump in here just because I think you broke up a little bit there, Nikita. So to clarify, yes, we're offering in-clinic abortion at the Champaign Health Center starting this week. There was a renovation needed in order to make that happen with our facility. So that clinic has doubled in size, and we are thrilled about that. And since our Springfield clinic was the only location that someone could receive an in-clinic abortion in Central Illinois prior to this expansion, access has now doubled in Central Illinois. And then also, we just wanted to flag that many of our Illinois-based patients are able to receive medication abortion via telehealth, where they have a virtual appointment with a provider and then receive their pills in the mail. This is only available to folks who live in Illinois, since we're not able to legally send pills across state lines.
Thank you, Lisa. Very helpful. This question is concerning downstate clinics. How do downstate clinics receive funds from the state and national organization, and what is the expected impact on these smaller facilities? Are there any plans to open facilities in Southern Illinois where none currently exist?
Okay, so all of PPIL's clinics are funded by PPIL's annual budget. Downstate clinics are funded the same way upstate by receiving a budget to meet the anticipated needs of their patients and community. So right now, there are currently 2 abortion providers in Southern Illinois, one which is operated by Planned Parenthood St. Louis region, and PPI assessing our options for possible expansion, given that Southern Illinois is surrounded by states who are losing access.
Okay. We have a question in the chat room. Do needs increase locally after the U of I students return to campus? And do you expect them to increase even more this year?
So I'm sorry, what was the question? One more time.
Do the needs increase locally in Champaign-Urbana when the students return to campus? And do you expect an even stronger increase this year?
I can address that, Nikita. I mean, I'm surely the student population has their own healthcare needs, and we always plan for places where universities to have kind of an uptick in appointments and plan for that ahead of time. Fortunately, U of I's return to campus correlates with our doubling the size of our Champaign Health Center, so we feel well poised to meet the needs of the local community and the student population.
Okay, so at this point, I think I'm going to just call on people who have put a question in the chat room just to make this open and interactive. Jane, I see you have a question in the chat room. Do you want to ask it?
Sure, it's just that I think I heard Nikita say that PPIL is the only provider of abortion services in central Illinois. So I take that to mean that Carl will not, that OSF almost certainly would not. I don't know about Peoria hospitals, but are hospitals simply not providing abortions?
According to what we know, we are the
That is
only provider of in-clinic abortion services in central Illinois. So yes.
Yes, that is.
And I think there's a question by Karen. Is that you, Karen? Is LWVCC? Is that Karen or is that?
Yes, that's me.
Okay, thanks, Karen.
I wanted to know whether PPIL would hope to see a particular piece or pieces of legislation brought forward in the fall that would support abortion rights in the current situation, or access to better access to contraception, for example.
So Lisa may want to chime in here, but and in this question well enough, PPIL is working very closely with legislators in Illinois to provide less symbolic policies and more strong anchored policies that will protect both our providers, but also our patients. And so, I'm very proud of, I know our CEO, Jennifer Welch, has been doing, being a staunch advocate and ally there and partner with legislators and holding accountable. So we do have some things coming down the line that I believe provide even better protections for, again, both providers and patients.
Could I ask a follow-up?
Absolutely.
What do you mean by less symbolic and more anchored?
Right. And so as we've seen, sometimes legislative pieces can have loopholes and not necessarily, meet the full gamut of needs. And so that leaves opportunities for issues, right? And so what we're hoping for is that through the staunch advocacy, they're working with legislators to write more anchored and secured kind of policies that have less loopholes, that these will provide better protection.
Thank you.
Thank you.
And then Jane, did you have another follow-up question? Or
Well, you read so much about how doctors are conflicted and hospitals may have their own policies. So my question is, if a pregnant woman's health was at risk and she was at Carl for treatment, would they perform an abortion if that's what was indicated?
Yeah.
For her greater health? Do we know?
I personally don't know that answer.
Neither do I.
Okay, so that's a community question. Are there, lots and lots of stories from other states about how doctors simply cannot do that. Here, of course, that's not the issue, but will they do it? That could be an issue. So query whether, abortion access is what it should be in the state of Illinois, despite our greater access than other states.
Agreed.
Mike, I see you have a couple of questions in the chat room. Would you like to ask them?
Yes, I was wondering, doesn't Illinois also need, or wouldn't it be desirable if we had legislation that would protect supporting organizations and actors who provide funds or logistics, like transporting patients to the clinic, not only protecting the providers and patients, of course, which is a primary concern, but organizations like Midwest Access Coalition, protecting them from, a lawsuit coming from Texas or wherever.
Absolutely, Mike. Thank you for bringing this particular point. So in my explanation, I guess I should have expanded that more. Even allies and organizations that are supporting these efforts to we're hoping that there will be more secure legislation to protect those individuals as well. You're absolutely right.
Mike, are there any additional questions?
I see there's a question there. Someone says, clinic recently, and by our, are you referring to Champaign's or Bloomington's or Springfield's? This is how has our clinic recently been a site for administrations and sidewalk counseling? Is this for Champaign?
Jenny, would you like to chime in?
You could answer the question speaking to all of the sites about which you have information. And may I say, more power to you. Thank you very much.
Thank you.
And I put quotes around sidewalk counseling.
Right. Lisa, you might want to chime in on this too. I do know of some anti-choice demonstrations taking place at many of our central Illinois and locations, which is why the escorts are so important. We actually need more escorts to at our centers. Yes, I have been aware of different demonstrations, anti-choice demonstrations. Lisa?
Yeah, it is pretty common at a small number of our sites. Anti-choice demonstrators tend to target centers that provide in-clinic or what you might know as surgical abortion care as opposed to medication abortion. So that being said, we anticipate Champaign to be kind of a target in an increased way, which is why we're proactively launching an escort program at Champaign. Our Springfield Health Center sees protesters on a very regular basis, as do many of our suburban Chicago locations. So yes, definitely something our security team monitors daily and that we take very, very seriously. And if you or anyone that you know might be interested in being a clinic escort, please think about signing up, and I'll put my email in the chat again. I can connect you with and I'll put the link to apply to be a volunteer if you already know you want to sign up. Oh, do I have a hand raised? Oh, I think you're muted, sorry.
Okay. I'm just curious, what are the duties of an escort from beginning to end? What would one expect to do?
Oh, that is a great question. Thank you. So it would just to clarify, it would start with a fair amount of training and a background check. So if you're interested in becoming an escort, you would apply for our general volunteer program and do kind of a 2-hour online general orientation to kind of learn more about what it means to be a volunteer and kind of our policies and more a deeper dive into the organization. And then at that point, you could do escort training, which is in person at the health center, where you would kind of learn more about what it means to be an escort. And generally speaking, escorts work in small groups. There's usually a small group of escorts or a group sized appropriately to how many protesters we're expecting, but never just one at a time, usually at least 2 or 3 per shift based on when we anticipate protesters to come. And we kind of anticipate that by monitoring social media activity and also patterns of when they show up to the clinic. So an escort would meet a patient at their car and ask if they'd like someone to walk them to the door. And a lot of times if there's protesters, they say yes. And then you kind of walk the patient to the door of the health center and kind of create a physical barrier between them and the protesters who are, hoping to deter them from going to their appointment, even if they might not be there to receive an abortion. And we have a strict non-engagement policy, so escorts never interact with the protesters, and they usually, are used to that. They don't expect to receive any interaction from the escorts. Does that answer your question?
Yeah. Yes.
Mm-hmm. Mike, I just wanted to get back to you if you're still on. Yeah, you are. Up in the top of the chat room, you had some questions. I wonder if you still wanted those answered or if you felt like they were answered already.
The only other question I had, it's kind of an aside about Midwest Access Coalition. We were wondering if they're ever going to have the bandwidth to expand their volunteer base to downstate Illinois, like Champaign area.
We hope so. You know, one thing that the Resolve campaign has been able to do is grant out funds to our partners like the Midwest Access Coalition so that they can increase their bandwidth in all ways. I don't have any kind of official updates about that at this point, but we know that the need is greater than just the Chicago area, especially now that we're adding these new expanded clinics.
And then Mike, the last question that you entered is interesting. If you want to ask that, it has to do with the Champaign Clinic.
Well, is there a bubble zone around the Champaign Clinic? Is the clinic on private property?
So we do, it is private property, technically. Many protesters will choose to stand like kind of on the sidewalk with a megaphone. So even like if they can't walk alongside the patient, they can interact with them in other ways.
Yeah.
You know, we see this happen in Chicago a lot where they might not be able to be right up against the door, but they can still like get a message across, you know, using kind of craftier methods. Nikita, did you have anything to add?
Oh, no, I was just mentioning, you know, phones, the signs that they may, you know, hold up and things like that. But right, physically coming into contact.
Mm-hmm.
Okay. Jane, you had a follow-up question to escorting.
Yeah, just curious where the escorts hang out when they're not escorting. I mean, do they have to stand around and listen to the megaphone, or can they go? I mean, how bad is it?
Good question. I mean, a lot of folks, they'll kind of stand together in a group near the door of the clinic. It's usually best to be outside so that you can see when a patient pulls into the parking lot. I will say it's not for everybody. You know, it's a big deal to be a clinic escort, and a lot of folks choose to volunteer in other ways because it's not an easy breezy duty for sure. It's tough.
Mm-hmm. That's all the questions in the chat room. Does anyone else have questions? They can just unmute and ask. Teresa?
You're on mute.
Unmute.
I could look this up on the web myself probably, but you know, in terms of the misperception, I think, about the abortion, you know, the surgical abortions, is that, you know, these are like carefree teenagers using this as a birth control method, that sort of thing. I mean, I know I've heard other things that, can you spout off sort of the, what do I say, the percentages of women in different stages of life who are seeking the surgical abortions, you know, the medical abortions, in like even nationally, or maybe just as it applies to Illinois from, you know, the data that they've been keeping?
I don't have patient statistics handy, and we don't often share them because we don't want to contribute to the narrative of our opponents in any way, because they find a way to weaponize any information that they have. What I can say is that a majority of patients that receive an abortion already have children. And there are many, many reasons why someone would need an abortion, some of them elective and some of them not. And what we hope to do is eliminate the stigma. Nikita, do you have anything to add?
You know, and to your point, I think it's important to understand 1 in 4 women in America will have an abortion by the age of 45. that's profound, and people need to understand that this can be keen healthcare. It is overall healthcare. So that would be the only thing that I definitely wanted to add to the conversation.
Yeah, and I would also say that the vast majority of abortions happen in the first trimester. So there is also kind of an opposing narrative that many people wait until, you know, close to birth or well into the second trimester to choose to have an abortion. But the vast majority of abortions that do happen later in pregnancy, which is again like a super small number, are medically necessary.
Absolutely.
Cecile?
Yeah, I was just wondering, what other opportunities are there for volunteers besides escorting?
Great
You know,
question.
wanna-
Oh, Nikita, you take it.
I know, Lisa, you're probably going to drop some information in the chat, but then also expand on this. But so many other ways. I think about our call centers. We definitely need help following up. I know Midwest certainly needs help with navigators, helping connect people with this. So that's really important. And those are the two that just jump outside of the escort assistance. Any others, Lisa, that you want to highlight?
Sure. So we are trying to grow our volunteer program in Central Illinois, and we have a kind of a staff person who full-time coordinates volunteers in the region in Central Illinois. And some of the other opportunities are kind of, you know, a little more fun, like representing Planned Parenthood at events by tabling and handing out materials and doing things that kind of come up on a one-off basis like that. And you would, if you became a volunteer, officially, you'd kind of receive updates with these opportunities and could sign up as you were interested and available.
Natalie, you had a question?
Yes, I was wondering who actually performs the abortion. Is it a local MD, nurses? I have no idea how it works.
Sure. Nikita, do you want me to take this?
Sure. Yes, you can take this one, Lisa.
Okay, so just to, in case anybody's still a little unsure of the types of abortion, there are medication abortion, which is the abortion pill. That can be administered by an advanced practice nurse. We have advanced practice nurses at every single one of our health centers. And can also happen via telehealth, as we mentioned earlier. In clinic or surgical abortions that happen in the health centers, they are performed by physicians, by MDs, yes. And those are staff members. Many of them are contracted and also work at other practices. We are also, and you know, up until recently, they've all been local. They've all, you know, worked in Illinois at other practices, but we are kind of having out-of-state MDs get licensed in Illinois and come to work here part of the time to help with this increased need.
Cecile?
As a follow-up, you mentioned navigators. Could you describe what a navigator does?
Yes, and Lisa, feel free to jump in after if I miss any. Navigators have been extremely critical, especially now, given that we're so many are seeing this influx of patients from out of state and folks who are seeking care and refuge in Illinois, in our state and seeking care. They are having to combat or overcome barriers, transportation and lodging, you know, as they're coming into our communities seek care. They're trying to find out resources for childcare. They're trying to resources for temporary funding for different things. And so what our navigators are amazing at doing is to kind of connect these folks with the resources necessary for them to have that peace of mind when they're coming for care. You know, navigators might make sure that they are any transportation issues are funded, making sure that they are safe travels, making sure that we answer any questions that they may have as they come share. And so again, it's a very compassionate role and integral, especially now with all the different bands that are happening.
Yeah, and I'll just say that at PPIL, we have full-time staff members that are navigators, a team that is growing. Nikita, as far as you're aware, do any of our partners use volunteers for that work?
Could you say that one more time? You broke it.
Oh, sorry. At PPIL, abortion patient navigators are staff members who are full-time. Do you know if any of our partners have volunteers that do that work?
Yeah, I do, especially Midwest. Yes.
Midwest Access Coalition?
Yes. Mhm.
Okay, great. Thank you.
Anyone else? Cecile, do you have any other questions or comments?
No, I'm excited at the planning that went into this and the fact that it's been 5-6 years that Planned Parenthood of Illinois knew the need was going to occur, and it has been able to garner resources and get set up, and will be meeting the need. They'll be meeting the need. So it's good for us to know.
Well, again, thank you all for your dedication. Thank you for thank you for inviting both Lisa and I to speak with you. This has been just an amazing opportunity. And the last call of action that I would have or ask you was just to continue to help us share this message and debunking a lot of the myths. So the information for today, we hope that you take it back into your communities and apply it to the work that you're doing.
Thank you, Nikita, and thank you, Lisa. Thank you so very much. We really appreciate you spending time with us, and we will support you. We will individually support you as we can, and you have given us some opportunities of what we can do.
Thank you for having us. It was really fun.
Bye-bye.
Okay.
Thank you.